So the first part of this evaluation was a systematic review of alcohol and substance misuse interventions that were delivered remotely. The first main finding is that remotely delivered interventions can help people to reduce their substance or alcohol misuse. However, there was much more evidence relating to alcohol misuse than other substances. Most remote interventions identified in the review were website or smartphone app based, so our wider evaluation is amongst the first to focus on interventions delivered mainly by phone and video conference calls, and this includes things like Zoom and Microsoft Teams. The review did not find any studies on experiences from service providers or users of remote interventions. Therefore, our wider evaluation is amongst the first to include the voices of staff and service users, and then combine that with data from services about outcomes for service users. This provides a unique and very in-depth evaluation. The review identified a number of promising approaches for supporting people to reduce their alcohol or substance misuse. A table with all of these details is available and will be shared widely. Some of the most promising techniques included helping people to avoid or reduce their exposure to things or people around them that act as a cue for the substance use or for drinking alcohol. These cues can be social or physical in nature. Another technique was helping people to weigh up the pros and cons of making a change to their alcohol or drug use, and ideally identifying the fact that the benefits of change outweigh the disadvantages. Third technique was supporting people to track their alcohol or substance use so that they can really see how much they are using and understand when they are making progress. This can be done using a smartphone app, a blood alcohol tracker, or a paper diary. From the main review findings come two recommendations. Firstly, service providers and staff should feel confident in offering remote drug and alcohol support, since findings suggest that remote support can help people reduce their drug or alcohol use. Secondly, there are a number of strategies, sometimes called behaviour change techniques, that show promise when included in remote interventions. We recommend reviewing the extent to which these strategies are currently used in your service or practice, and revising session content or documentation where needed to include more of these.